In this video, we are going to discuss about the topic hip joint. This is the part 1 of the video in which we will discuss about the articulating surfaces, the cartilage, the capsule and the ligaments around the hip joint. First of all, we will start with the hip joint introduction. So you can see that the hip joint is formed by the head of the femur and the acetabulum of the hip bone. So the joint will look like this. That is So if this is the acetabulum of the hip bone, you can see that the acetabulum of the hip bone is articulating with the head of the femur. So this is the head of the femur. This is a greater trochanter, this is a lesser trochanter. So if the femur is like this, you can see that this is the head of the femur, this is the acetabulum of the hip bone. The cavity of the acetabulum bears an articulating surface which articulates with the head of the femur. So you can see that the head of the femur is like a ball and the acetabular cavity is like a socket. So this is a ball and socket type of joint. This is a ball and socket type of synovial joint. So we have discussed about the type of the joint. So what kind of a joint is hip joint? It is a ball and socket type of joint and it is a synovial joint. So now we will discuss about the articular surfaces. So the bones which are taking part in the articulation are the head of the femur and the acetabulum. Now we will discuss the articulating surface. We will take the head of the femur. So which are the articulating surface? One is the head of femur. So one of the articulating surface is the head of the femur. So the head of the femur is covered with a hyaline type of articular cartilage. We know that the articulating surfaces of a joint are covered with articular cartilage. Now the head of the femur also bears an articulating cartilage. So bears an articular cartilage. The articular cartilage is covering the head of the femur. So it is covering the entire aspect of the head of the femur except at an area near the center. So except at an area near the center, the articular cartilage is covering the head of femur. So this is the articular cartilage. Now at the center you have a central bit which is called the fovea. So inserted into the fovea you have the ligament of head of the femur. So inserted into the central bit you have the ligament of head of femur. So what you see here is the articular cartilage. So it is actually hyaline cartilage which is covering the head of the femur except an area at the center which is called the fovea, and the fovea, attached to the fovea you have the ligament of head of femur. So now that is about the articulating surface on the head of the femur. Now which is the other articulating surface? That is the acetabulum. Acetabulum is the other articulating surface. So which part of the acetabulum is articulating with the head of the femur for the formation of hip joint? Now let's look at the acetabulum first. So if we take the acetabulum, we can see that it is like this. It is bearing a notch at its lower part, and the notch is known as the acetabular notch, and you are having a horseshoe shaped articulating surface here. So this articulating surface is roughly horseshoe shaped. So this is a horseshoe shaped articulating surface on the acetabulum. So and this articulating surface is covered with a cartilage. articular cartilage is covering the articulating surface on the acetabulum. So this surface, which is the articulating surface of the acetabulum, is known as lunate surface. Lunate surface which is covered with surface which is covered with the cartilage is the articulating surface on the acetabulum. Now the remaining part of the acetabulum is known as the acetabular fossa. So this remaining part is known as the acetabular fossa. So and this acetabular fossa is covered with a hyacinth pad of fat. So what I have drawn in yellow color is a hyacinth pad of fat which is covering the acetabular fossa. Now if you look at the acetabulum, you can see that there is a horseshoe shaped area which is called the lunate surface, and the lunate surface is covered with the articular cartilage. So this is the part of the acetabulum which is articulating with the head of the femur. That is, the lunate surface of the acetabulum will articulate with the head of the femur. Now the remaining portion of the acetabulum except the lunate surface, which is covered with a pad of fat, is known as acetabular fossa, and the acetabular fossa does not take part in articulation. This is a non-articular part. Now here you can see a notch which is called the acetabular notch. So acetabular notch. So attached to the acetabular notch you have the transverse acetabular ligament like this. So the transverse acetabular ligament is attached to the acetabular notch. So these are the parts of the acetabulum. You can see here there is an articulating part which is the lunate surface covered with the cartilage. The non-articulating part is the acetabular fossa which is covered with the hyacinth pad of fat, and there is an acetabular notch into which the transverse acetabular ligament is attached. Now you have an important part here that is attached to the margins of the acetabulum. You have the acetabular labrum. So acetabular labrum is attached to the margins of the acetabulum like this, and it is attached to the two ends of the transverse acetabular ligament also. So it is like this. So what is the function of this acetabular labrum? So the acetabular labrum, it functions in deepening the acetabular cavity. So it helps in deepening of the acetabulum, and it forms a tight fit around the neck of the femur. So that is the acetabular. This rim is known as acetabular labrum, which deepens the acetabular cavity, and it also forms a tight fit around the neck of the femur. So that is actually a fibrocartilaginous structure. Acetabular labrum is a fibrocartilaginous structure. So you have learned about the articulating surfaces, that is the head of the femur and also the acetabulum. And see the picture here. So this is a side view of the acetabulum and the femur. We know that the head of the femur is articulating with the acetabulum. Now you know that not all the parts of the acetabulum will articulate with the head of the femur. Only the lunate surface of the acetabulum, which is actually a horseshoe shaped area on the acetabulum, will articulate with the head of the femur. So this much part is known as the lunate surface. You can see the lunate surface which is covered with the cartilage. So this is the articulating part on the acetabulum which is covered with the articular cartilage. Now the head of the femur is also covered entirely with the articular cartilage except a region which is called the fovea, that is the central pit. So attached to the fovea you have the which ligament, that is the ligament of head of the femur. So that is the ligament of head of the femur. So what you are seeing here is the articulating surface. You can see the articular cartilage here. Now what about the capsule, fibrous capsule? Now we are discussing about the fibrous capsule of the hip joint. So as every joint is hip joint is also having a fibrous capsule. Now we will see the capsular attachment. Now you can see the capsular attachment here. So now you will see the capsular attachment. You can see that the capsule is attached medially to the acetabulum and laterally to the femur. So medially you can see that the capsule gets attached into the margins or the rim of the acetabulum like this. So it gets attached to the rim of the acetabulum. That is a medial attachment. Now laterally it gets attached to the femur like this. So it gets attached to the femur like this. So that is the attachment. Now you can see the medially it is attached to the rim of the acetabulum and laterally it gets attached to the femur. Now what is the anterior attachment? So this has to be noted, that is anteriorly it gets attached to this. So we can see that there is an intertrochanteric line here. So anteriorly it gets attached to the intertrochanteric line like this. So that is the attachment. And if this, so this is an anterior view, we can see that the capsule is attached. So this is the capsule, we can see the capsule is covering the joint like this. So medially it is attached to the rim of acetabulum. Laterally it is attached to the femur. Then anteriorly it is attached to the intertrochanteric line. So what is the significance here? That is anteriorly it is attached to the intertrochanteric line. So on the anterior aspect, the entire neck of the femur is intracapsular. So as the capsule is attached to the intertrochanteric line on the anterior aspect, the entire neck of the femur on the anterior aspect is intracapsular. Now on the posterior aspect, if you look at the posterior aspect, so consider this to be the posterior aspect. If this is the posterior aspect, on the posterior aspect the capsule is attached 1 centimeter. This is the intertrochanteric crest on the posterior aspect. So this is the intertrochanteric crest on the posterior aspect. The capsule is attached 1 centimeter medial to the intertrochanteric crest on the posterior aspect. So this is the capsular attachment on the posterior aspect. So posteriorly the capsule is attached 1 centimeter medial to intertrochanteric crest. So what is the significance here? As the capsule is attached 1 centimeter medial to the intertrochanteric crest on the posterior aspect, some part of the neck of the femur is extracapsular. That is, some part of the neck of the femur is not intracapsular, it is extracapsular. That is the significance. So on the anterior aspect, the entire neck of the femur is intracapsular, whereas on the posterior aspect, because of the capsular attachment like this, some part of the neck remains extracapsular. So that is the significance. So that is the attachment of the fibrous capsule. So this capsule gets attached like this. Some part of this much part of the neck of the femur remains extracapsular. So that is all about the fibrous capsule. Now you will see the important ligaments around the hip joint. So the first ligament which we are going to discuss about is an important ligament that is known as the iliofemoral ligament. So the iliofemoral ligament is also known as ligament of Bigelow. Ligament of Bigelow. So, and this is a ligament which is in anterior relation to the hip joint, and this is one of the strongest ligament in the body. Now what is the attachment of this ligament? So it is an inverted Y-shaped ligament. So the shape is inverted Y shape. Now you see that the apex of this ligament is attached to the anterior inferior iliac spine. So this is the anterior inferior iliac spine. The apex of this ligament is attached to the lower half of the anterior inferior iliac spine. Now it is the base is attached to the intertrochanteric line. So what you see here is the intertrochanteric line. So the base is attached to the intertrochanteric line like this. So it is an inverted Y-shaped ligament like this. Now the apex is attached to the anterior inferior iliac spine. The base of the ligament is attached to the intertrochanteric line on the femur. Now what is the function of this ligament? The function is that it is present anterior to the hip joint. You can see that. And the function is that it prevents the trunk from falling backwards. In standing posture. So that is the function. So you can see that ligament is triangular in shape also. Now it consists of lateral fiber, that is the upper oblique fiber is there is a lower vertical fiber. So this is the lower vertical fiber, this is the upper oblique fibers, and the middle fibers are very thin. So that is about the iliofemoral ligament. That is the strongest ligament in the body. It is one of the strongest ligaments in the body, and the function is that it prevents the trunk from falling backwards in standing posture. It is a triangular ligament with the apex towards the lower part of anterior inferior iliac spine, and the base is attached to the intertrochanteric line. It consists of upper oblique fiber and lower vertical fibers. So that is the ligament of Ischlo or iliofemoral ligament. So that is the first one. Next one is, the second one is the pubofemoral ligament. So pubofemoral ligament. So from the name itself you can see that it is extending from the pubis to the femur. So the pubofemoral ligament, it is also triangular in shape. The superior attachment is to the iliopubic eminence, the obturator crest, and also the obturator membrane. So it is like this. And it is merging with the capsule. Inferiorly it merges with the capsule and also with the lower band of the iliofemoral ligament. You can see that it is merging with the lower band of the iliofemoral ligament also. So what is the attachment of this ligament? It is attached to the iliopubic eminence and the obturator crest and the obturator membrane, and on the lower part it merges with the capsule of the hip joint and also with the lower fibers of the iliofemoral ligament. So this one is the pubofemoral ligament. So this is the pubofemoral ligament. Now, so what is the function? It supports the joint infiromedially. Now you have another ligament that is known as, so the next ligament is the ischiofemoral ligament. From the name itself you can see that it is extending from the ischium towards the femur, and you can see that it is attached on the ischium below the acetabular margin like this, and it takes a turn superolaterally, takes a twist superolaterally, and gets attached to the fibrous capsule. That is, even though it is arising from the ischium below the acetabula, it merges with the capsule, and some of which is attached to the greater trochanter also. So it is attached to the ischium below the acetabular margin, and it takes a turn, it takes a twist superolaterally, and it merges with the capsule of the hip joint like this. So it reinforces the capsule of the hip joint posteriorly. So it is comparatively a weak ligament. It is comparatively weak and it extends from the ischium to the fibrous capsule. That is, it extends from the ischium but it merges with the fibrous capsule. Some of the fibers may get attached into the greater trochanter also. Now, what is the function of the ischiofemoral ligament? It limits the medial rotation of the thigh. Limits medial rotation of the thigh. So these are some important ligaments, that is iliofemoral ligament or ligament of Michelot, and the pubofemoral ligament and ischiofemoral ligament. So this one is located posteriorly also. It reinforces the capsule posteriorly and it limits medial rotation of the thigh. Now you have seen that there is a ligament which is passing into the head of the femur, that is known as the ligament of head of the femur. That is also called ligamentum teres. And so in this way you can see that this is the head of the femur, and the head of the femur bears a central pit or depression which is called the fovea. And if this is the acetabulum, we can see the Havasin pad of the fat, and there below there is an acetabular notch here. So this is the acetabular notch. So traveling across the acetabular notch, we have the transverse acetabular ligament also. Now we have another ligament which is known as the ligament of the head of femur. So that is the fourth one, that is ligament of head of femur. Which is also called a ligamentum teres. It is a flat triangular ligament. So the apex of this ligament is attached to the fovea capitis and the base is attached to the margins of the acetabular notch. The apex is attached to the fovea capitis and the base is attached to the margins of the acetabular notch and to the base of the transverse ligament. It is very thin and the function is that it transmits the arteries to the head of the femur from the acetabulum. That is, the acetabular branch of the obturator artery and the medial circumflex femoral artery passes from the acetabulum towards the head of the femur through this ligament. So this is the ligament of head of femur or ligamentum teres. And the next ligament we have discussed about it earlier. So we have seen that so this is the acetabular cavity and this is the notch this is the notch you see here. So now, and the notch is extending across the notch, you have the transverse acetabular ligament. So draw a diagram, that is this is the notch here, this is the acetabular notch, and attached to the margins of the notch you have a ligament. This ligament is known as transverse acetabular ligament. So transverse acetabular ligament is there. So this is a part of the acetabular labrum actually, which bridges the acetabular notch. So by the attachment of this ligament, the notch is converted into a foramen which transmits the acetabular vessels and nerves into the joint. So because of the attachment of this ligament, the notch is being converted into the foramen which transmit the nerves and blood vessels into the joint. So which are the important ligaments you have seen here? That is the iliofemoral. This is the iliofemoral, this is the pubofemoral, there is ischiofemoral ligament, and you can see the ligament of the head of femur or ligamentum teres, and there is a transverse acetabular ligament. Acetabular labrum have been previously discussed. Now we will see the synovium of the hip joint here. So this is the side view of the joint. You can see that this is the acetabulum which is articulating with the head of the femur. So this is the lunate surface of the acetabulum which articulates with the head of the femur. So this lunate surface is covered with the articulating cartilage. Now the entire part of the head of the femur which is articulating with the acetabulum is covered with the articular cartilage except at the fovea. So inserted into the fovea we have the ligament of the head of the femur like this. Now you can see that we have drawn the fibrous capsule. Capsule of the knee joint is attached from the acetabula margins to the femur like this. Now it is attached like this. So this is the fibrous capsule. You see here is the fibrous capsule, and this was the articular cartilage. So cartilage. Now what you see here, this is the ligament of head of femur. Now we are trying to see the synovial membrane which is lining the capsule. You can see that the synovial membrane of the hip joint lines the fibrous capsule. So this is the fibrous capsule in violet color. So it is lining the fibrous capsule like this. So on both sides it is lining the fibrous capsule like this. So attached to the margins of the acetabulum you have the acetabular labrum. So this is the acetabular labrum. So that is the acetabular labrum. The synovial membrane also encloses the acetabular labrum. Now you can see that the synovial membrane also lines the neck of the femur. So it lines the neck of the femur till the articulating surface. So it is lining the neck of the femur till the articulating surface like this. Now it is also covering the haversine pad of the fat. Here at the non-articulating surface of the acetabulum you have the haversine pad of fat. Now the synovium also covers the haversine pad of fat. Now around the ligament of the head of the femur, the synovial membrane is forming a fold here. So it is forming a fold around the ligament of the head of femur. So that the blood vessels and nerves entering the joint is carried through this ligament into the head of the femur. So the blood vessels and nerves entering the joint through the acetabular foramen reaches the head of the femur through this fold of synovium. So you can see that the synovium is covering which all parts, that is synovium is covering. It is lining the fibrous capsule. It is also lining the acetabular labrum. And it is covering the neck of femur. And it is covering the haversine pad of fat. And it forms a fold around the ligament of head of femur. So occasionally the synovial membrane may protrude through an opening in the anterior part of the capsule between the iliofemoral and ischiofemoral ligaments to become continuous with the psoas bursa. So that is about the synovial membrane. So we have seen about the hip joint, its articulating surface, the fibrous capsule, acetabular labrum, the important ligaments, the synovial membrane. So thank you for watching this video. To see more videos from our channel, please subscribe the channel. Thank you.